Early on, back in January, when we knew both the vaccines were going to be approved by the FDA, we knew our population was at a high risk. They just had a lot of people in and out of their lives due to home staff. We knew that that was an additional risk to staff and individuals served. We also knew signing up for the vaccine would be a challenge for a lot of people we support, so we wanted to make that as easy as possible.
Well, I thought it was very organized and well run, and
very polite staff.
Friendly too.
Yes.
We also knew we had a lot of internal resources, so we have space that's not being used because of COVID. Staff aren't coming into work in our offices. We have 3 RNs that had time available, and we also had a lot of internal staff that might be able to work the clinic. We were able to develop a list of our resources and present it to Hamilton County Public Health, and they took us up on the offer, and we were one of the first pods that operated on their behalf.
I was a little bit scared at first, but now I'm not.
I get the medicines on me get sick.
The first few clinics were an emotional roller coaster. None of us had really ever operated a medical clinic, and so it was totally something that we were just trying to problem solve through and figure out the best way to operate. Although we felt like hamsters on wheels behind the scenes, I'm not sure that people always felt that when they were at the clinic receiving their vaccinations.
It was fabulous. It was small, it was quiet, it was trained staff, it was people who understand.
It went smooth.
Early on, it took a lot more manpower than it does currently. I remember our first clinic, I think we had 100 people scheduled and we had 8 nurses. Our busiest clinic day, we had right around 220 people, and I think we were able to accomplish that in a full day with 4 nurses, not 8 nurses. So we got much more efficient.
The main reason I think that we decided to do it is that we have relatives that had COVID, and one of them was fairly ill, did not have to be hospitalized, but we knew it was a serious disease and we didn't want to infect other people. And the other reason is we want to be able to travel.
The vaccine was very hard to locate at that time, so we had a great relationship to Hamilton County Public Health, but they didn't know always if they were going to get vaccine delivered. So there were some days early on when we had a clinic scheduled and we did not know till the afternoon of the day before whether we would have vaccine for that clinic or not. So that was stressful. It was scary because we had people counting on us and we didn't want to disappoint them.
Why did we come?
So I don't get COVID. I just want to be protected.
It felt really good to have such a positive response, and people really appreciate the services, especially for some people who may not have been able to register for the vaccine at a community clinic just because it was such a struggle early on, or maybe because of different factors they aren't comfortable going into a clinic due to health reasons or just being around other people. So we were able to make accommodations, which was really powerful. And it was hard. I mean, there were days when we had a clinic operating 4 days a week, all day long, and we were still doing our regular jobs. It was a struggle, and we had a great group of volunteers. I think we had just around 30 people from HCDDS that regularly donated their time. It was just a great experience. It was really nice being able to support the community and our providers and our individuals and their family, just to make something that's been such a scary time such a nice closure experience.